Annoying redness and blotches on the face are common complaints, but how do you know when your irritation is something more than just dry skin or acne? If you are experiencing painful redness, you may be one of the estimated 14 million Americans suffering from rosacea. And here to tell us more about the condition and how it is treated is dermatologist Dr. Doris Day. Dr. Day, great to have you back on the show.
Thanks for having me.
So rosacea is something that I guess affects a lot of people. Can you tell us what it is exactly?
Rosacea is a very common condition, and we think it affects at least 14 million Americans. And the problem is that most people don't recognize that they have it until they go see their doctor. And so they're treating it as all sorts of other conditions, and those treatments can actually make the rosacea worse.
Is that because the symptoms are so vague?
Well, the symptoms are a little bit unclear sometimes. They can mimic other things. We actually call it the great disguiser. You can see several different things. Sometimes you can have just simple redness and broken blood vessels. That's one type. Men tend to get a prominent nose, something we call rhinophyma, a bumpy, bulbous nose. Rosacea can also affect the eyes, and that's called ocular rosacea. You have a gritty feeling in the eyes or lots of styes, but it can also look a little bit like acne, that you can have pimples and bumps in the skin as well. But it is different than adult acne because that's more hormonal, it's more on the lower face, and with acne you do have more blackheads and whiteheads, and that's not seen in rosacea. Rosacea does affect the cheeks, the chin, the nose, the forehead, and adult acne is really more along the lower face.
But rosacea does or can develop as we get older, is that right?
Rosacea is more of an adult pattern, and that's why some people do call it adult acne. So you start to see it in the late 20s, 30s, 40s, and for most women who get it, it does get a little bit better after menopause. So that's something to look forward to with menopause.
That's right.
The one thing. Exactly.
Is it hereditary? I mean, how do we get it?
We're not really sure. There may be a hereditary component to it. And we really don't know the main underlying cause. Like with acne too, we don't know the main underlying cause, but we do know that with rosacea, there's one good thing about it is that there are triggers, so you have some control. And the triggers are pretty clear. So we know alcohol is the biggest trigger for rosacea. Stress is a very big trigger, and obviously you can't not stress at all because, you know, in life, if you're living it properly, there are going to be stressors.
Of course.
But you can manage your stress better, and if your rosacea is flaring quite often, you have to think about what your triggers are, and if stress is one of them, you have to look for ways to manage that stress.
Absolutely.
Extremes in temperature can also be a very big trigger. So in the winter, when it's cold and windy outside and you have that blast of dry, hot air when you go in, that can be a trigger. You also have to think about foods, and people tend to have their own personal triggers. Spicy foods tends to be a very big trigger for most people, but you have to think condiments and small things. It could be vinegar, soy sauce, wasabi, little things, not necessarily the main dish itself. And you have to see what causes your flare the next day. You'll see that you're red, and think about what you had the day before and try to figure it out that way. So it's nice to have at least some control over it.
Absolutely. We know that it can be painful and unsightly, but you say if you have rosacea of the eye, for instance, it can even lead to blindness?
That's true. Ocular rosacea, rosacea of the eyes, in some cases can ultimately lead to blindness. And so when somebody comes in with rosacea of the skin, I will ask them about eye symptoms, and I will treat their rosacea a little bit more aggressively, moving into medications by mouth rather than simply topical medications to make sure we get that under control and work closely with an eye doctor.
All right, so let's talk a little bit about treatments, because it's my understanding you can't completely cure rosacea. Is that right? You can just keep it under control?
Absolutely. We don't really know what it is, so we can't target it directly at this underlying cause. We can just know the triggers and try to control that, and we know that there are some prescription and over-the-counter medications that do help calm the rosacea and minimize the flares. So in the prescription category, there's a medication that has FDA approval called Oracea. This is a pill. It's a very, very low dose doxycycline, and it's in a timed release. So what happens is when you take the medicine, some of it is released right away and the rest is released over time. It has no antibiotic effect. It's a very low dose, so your body and any bacteria won't even recognize that it's there, and you won't have risk of antibiotic resistance or other issues.
That's great.
But it's pure anti-inflammatory. And that's also really good as a side effect. I'm married to a dentist, so I pay attention to these things, but it's good against gum disease as well.
Oh, it sounds
so it
like
helps more than one thing.
Absolutely.
But it helps great in my experience with the ocular rosacea, but also helps with rosacea of the skin in that you get fewer flares, and the flares don't last so long and they're not quite so bad. I use it in conjunction with topicals. A topical metronidazole like Metrogel or Noritate cream can be very effective.
And these are also prescription
These
topicals?
are prescriptions,
okay.
and they're not irritating, they're not antibiotic, they're not cortisone creams. They're just great prescription meds that you can use for a long period of time that will help minimize the flares and help the flares clear more quickly. And then there's another topical prescription called Finacea that helps with the redness, any discoloration, and the bumps that come with rosacea as well.
Are there any treatments that you do in your office?
Yes, there are great treatments. Part of what we have with rosacea is treatments that can help it, and one of my favorite things to do is something called the Athera isolase, and that helps both treat the bumps and the pimples of rosacea and the redness. And this is done over several treatments in the beginning and then just a few maintenance treatments a year.
Is it a laser or what?
It's intense pulse light, and then there's a suction component as well. It's not a painful treatment and doesn't take very long, and really helps give you great control of the rosacea.
Now, what about non-prescription or over-the-counter options?
This is so important because one thing about rosacea, it's a little different than just having sensitive skin, but what you don't put on your skin is just as important as what you do put on your skin. So what happens is before people recognize that they have rosacea, they're using very high concentrations of salicylic acid or glycolic acid, and those might irritate and make the rosacea flare. So look for niacinamide, caffeine, hydrators. Sun protection is so important, an SPF of 30 or higher.
And some of these products you brought here are great examples, right?
Absolutely. And the thing is that in the drugstore, you have so many great choices, but basically look for fragrance-free, dye-free as much as possible. So you really want less in the product rather than more.
And skin
I like
soothers.
retinols and retinoids for rosacea. I don't have a problem with that, but don't always look for the highest concentration of ingredients.
Right. And Dr. Day, where can people go to get more information about rosacea?
There are two excellent websites. You can go to bestfacedforward.com or rosacea.org.
All right, Dr. Doris Day, thank you so much for all this great information. And for more health and wellness news, be sure to check out the health page at abcnews.com.
ABC News Now. Good to know.